This is a visual demonstration of the Dialaflow tubing for reference after a face-to-face instruction by a home health RN. Please refer also to your written instructions provided in your patient packet. Let's get started by washing your hands with warm water and soap and drying with a paper towel. Gather your supplies, which will include your medication bag, which needs to be removed from the refrigerator 2 hours before, your alcohol wipes, your tubing, your saline and heparin syringes, and your end caps. You can prepare your medication bag on the IV pole or on the table as I'm going to demonstrate. You need your tubing and your room temperature IV bag. You'll need to remove 2 covers, one from the bag, the blue port, and one from the tubing on the spike. You'll need to remove both the protective coverings. The one from the bag, which is the blue port, which you may have to pull with some effort and it will create a popping noise, and the cover over the spike. Without touching the outside, insert the spike into the bag with a twisting, pushing motion. Invert the bag, squeeze the drip chamber until it's half full. Place it on the IV pole. Turn the tubing from the off position to the open position. Unclamp, allowing the medication to go through the tubing. When it reaches the end of the tubing, clamp. Inspect the entire IV tubing for gaps of air and remove them before infusing. This is a demonstration on preparing your IV line for your infusion. You'll need a saline syringe and a couple alcohol wipes. Remove the plastic from the syringe. Remove the cap from the top. Set it upside down on a clean surface. Pull back on the syringe to break the seal and push the fluid up towards the top to expel the small air pocket until there is fluid at the end of the syringe. Recap the syringe. Open an alcohol wipe and alcohol wipe the sides and the end of the injection cap for a full 15 seconds. Without touching the end of the syringe or the injection cap, remove the cap, line up the ends, push and twist the syringe onto the cap. Slide the clamp open and apply gentle pressure. If you feel resistance, call your home health nurse. If you feel no resistance, pulsate the infusion for the entire syringe. Remove the syringe and you're ready for your infusion. Next, we're going to connect the infusion. You'll need a couple alcohol wipes and your tubing connected to your IV bag. Alcohol wipe again, the sides and the top of your injection site for a full 15 seconds. Remove the end cap from the tubing. Line up, push and twist. Extend the IV pole all the way up, as high as it will go. Tighten. Dial the tubing to the desired rate. Open the clamp and monitor the IV. You may need to have your home health nurse help you adjust the rate as it tends to go a little bit slow. When your IV bag is empty, clamp your tubing. Disconnect the tubing from the injection cap. If you are using the tubing for another dose within that 24 hours, you will need a blue cap. Open the paper without touching the end of the cap. Insert it onto the end of the tubing. You will need to take this entire thing, including the empty bag, and put it in the refrigerator until your next dose to use the tubing again on a new bag.